What was it about the Cera system that first got you interested? Because I know we've been talking for a while and we've met at a lot of these events.
For our audience, like photobiomodulation uses red light.
Because I know you're coming from a medical background. The device is a wellness device. Who you think this device talking to about this device?
Most of my patients, any suffering from IBS, even brain fog.
Hi, Arpit. It's so lovely to have you here. We're very honoured and privileged to have you join us as Chief Medical Officer at CeraThrive.
Yes, even I'm happy and excited to in this journey.
Thank you so much. Maybe you could just talk a little bit about yourself and why you've decided to take this position with us.
So I'm a cancer surgeon and a gut specialist, and I see a lot of patients. The more I deep dive into more of my patients, anything coming from gut, IBS, piles, or like even brain fog, even sleep issues, everything of the brain and the gut are connected. So I say always that most people treat gut and brain as two separate entities, two separate systems. But clinically, we all know that it's one passport, the gut brain axis. IBS, brain fog, anxiety loops, even sleep disruption, low energies, they often travel together and they are connected. So, like, I joined because I see like two core bottleneck in modern patients. Number one is low cellular energy, and that means their mitochondrial is dysfunction. And number two is dysregulated nervous system. And overall, which I say that most patients are in their red mind overdrive state or sympathetic overdrive state. I talk about the red mind and the blue mind, and with CeraThrive, with photobiomodulation, we can activate the vagal tone and bring it to the more calmer parasympathetic tone, bringing our heart rate down. And so these are the main two reasons. And a tool like CeraThrive, they which aims to like use the photobiomodulation simultaneously on our brain and our gut, and it's very clinically interesting, and the results are phenomenal.
Yeah, maybe you could just tell us what was it about the Cera system that first got you interested? Because I know we've been talking for a while and we've met at a lot of these events, but what is the main aspect of the Cera system that you particularly like?
So, for our audience, like photobiomodulation uses red light and near infrared light to influence various kinds of cellular signaling, and including the cytochrome C oxidase pathway, the ATP production, and the oxidative stress. The clinically, I feel like simultaneously targeting. I have yet to see other device in like whole of the world. I have been traveling to so many places who are like doing this simultaneous gut brain activation through photobiomodulation. Everybody knows that the dysregulated nervous systems needs to be activated, maybe through breathing or maybe through other techniques. We need to activate our vagal tone. So I would not say that CeraThrive is one thing which like like the one golden tool. It's a great adjuvant to use along with your breathing or whatever other things you are doing to like autonomic downshifting towards the parasympathetic or the blue mind. So I loved about this that there is a device where you can simultaneously use. And so I give you my personal thing. As soon as I wake up in the morning and the last thing I go to bed, this is my thing. And then when you add the sounds and the different modes you can entrain, so you can add the Schumann resonance, for example, which is my balance, which is my favorite one. And then focus, you can add the gamma waves, and then you and in meditate you can even take the gamma waves up to 100 hertz. So the gut brain logic, I believe, it's obviously works through the vagal nerve, through inflammation signaling pathways and like metabolites and the mitochondria, and the obviously the stress circuits and the HPA axis.
Let's talk a little bit about who the system is suited for and perhaps who it's not. Because I know you're coming from a medical background. The device is a wellness device. So maybe you can talk a little bit about who you think this device, who you're going to be talking to about this device.
So see, ideally, as I spoke, like most of my patients, any suffering from IBS, even brain fog, they are connected. So I would probably be using uh, to all the clients which are accepted to trying different adjuvant modalities along with the traditional pharmacological and other issues. I believe like it can be used for all the people except for like, people with seizures and those kinds of diseases we might need to avoid. But again, that also we spoke earlier, also we can decrease the dose and the intensity and we can still work on it, because I don't see any real side effect kind of a thing. It's a pretty safe device. And like light, we all have very interesting experiences with it. But if you add different modes in gentler way, I don't see any kind of clear cut contraindications for it.
That's right. We're really just mimicking sunrise and sunset, right?
Exactly,
So
exactly,
it has a
absolutely.
very high safety profile. And talking about that, are there any kind of groups of people that are excluded? Children, elderly people.
I would say with children and with elderly people, we can use with more precautions and ideally under a guidance of a doctor. But I would say may not be for people like for acute conditions like suffering with fever and like low immune system or immediate sleep issues. They may avoid it. But once you're targeting the long term, the chronic issues, then I think it's for almost everyone. At the same time, we need to understand that it's not a magic wand, and if we need to work on the basics like the sleep, obviously the protein intake, the gut microbiome diversity, movement, as you mentioned. It definitely is mimicking sunlight, but still natural sunlight, breath work, mental hygiene, all these run the background show, and all these external adjuvant devices can only enhance the effect and but cannot 100% surely replace it.
That's right. So we're really looking to integrate this technology into people's existing wellness programs because
Mhm.
people are already kind of doing these different things, and we're just going to be developing some protocols, doing some webinars, giving some information on how people can then integrate red light therapy into their current program is what we're going to be doing,
Absolutely,
mate.
absolutely. And
Yes,
also my intention is to use it as an adjoint for understanding and working with their different patients on their clarity, on their calmness of the cognitive system. And then personally, I've been tracking with my HRV, with my various gadgets, my sleep and other inflammatory marker scores. And as we already discussed, we will be partnering with various kinds of mitochondrial tests where pre and post, so that we can really get some tangible measuring things, so that once we are prove it on paper, then it becomes easier to know. What I would love to see next is like structured trials, which we are again working on for IBS, different phenotypes, mixed type and diarrhea type, how which kind of IBS probably responds better. And then various brain fog cohort patients, and even stress biomarkers like the mitochondrial test which we discussed.
that's right. And educating people on how, they may think they have a brain symptom, but first of all,
Hmm.
we need to deal with the gut, and then some of those symptoms resolve anyway. I think it would be exciting to do education around this whole
Yeah,
aspect of,
exactly. Like people, like for example, most doctors, even in India and elsewhere, they still consider IBS as just a gut issue. But
yeah,
IBS, it's not just the gut; it's the gut plus the nervous system and plus the inflammational signaling issues. So when the brain feels like in threat mode or the red mind mode, the gut
yeah.
often follows. As we all know, that's the even the markers like serotonin and in the brain and the in the gut are directly connected. So adjuvant tools like CeraThrive, they can obviously reduce the friction and support the compliance.
Thank you so much. Well, I'm so looking forward to our collaboration, Arpit. Thank you so much for kind of honouring us by coming on as our CMO. We're really looking forward to it. And we will be posting out when we're doing our webinars and courses soon, so people can stay tuned for that.
Absolutely. Absolutely, I would be. And last time when we did a bigger webinar, I enjoyed the detailed questioning, because many people are actually suffering from these kinds of chronic issues, and they're looking for like any adjuvants which can enhance even slightly any device things. Because see, most people consult so many doctors for IBS and other issues, and they are still stuck. And so ultimately, they also need to understand that obviously medicines, I'm not saying that this is again, this is FDA listed, FDA approved, but not like you cannot replace the treatment with CeraThrive. But it is a beautiful non side effect adjuvant, apart from very, like as we discussed, elderly people and some children and maybe suffering with acute fever, nausea, and all those people can avoid it, but again they can still take it under the guidance.
That's brilliant. Okay, so you and I will be doing our world tour soon, I'm sure. So we'll make sure that we do some webinars that are on different time zones, because the last webinar we did was difficult for the US, but we will be doing a US one
We'll
shortly.
adjust
So
according to the schedule, and I would definitely work around it.
Yes, let's do that. Okay, then, Arpit, thank you so much for your time, and I really look forward to the collaboration, and we will keep people posted. Thank you.